All right, welcome everybody. We're going to get started. Brandon, can you just confirm?
Yep, you're good.
Hear me? Okay. Well, welcome everybody. I'm going to go through these slides, and if you have any questions, you can go along and put it in the chat, and Brandon will address your questions, and we'll ask that if you could mute yourselves in the meantime and put any questions in the chat, and then if we have time at the end for some questions, we can do that. Or if you want me to speak on something in particular, you can go ahead and chime in on the chat and we can talk about it. So I'd like to start off this presentation in terms of a tool that athletic trainers can use to show your value, improve patient care, help you add staff, which I have done through documentation, increase your budget, and potentially even save your career if you have something documented with a certain situation the right way to help protect yourself. Documentation can do all of these things. So I'm glad that everyone is here today to learn more about documentation and also how ATGenius can help you do it in the best way. We started our business in 2016, and we like to say bringing out your inner genius, because we think that the mission of our EMR system is to really help you do your job more efficiently, to show your worth, to show your value, to communicate better with coaches, with patients, and also help you feel more organized in everything that you do. So just a few words about us, the developers. Brandon and I developed ATGenius together. We are brothers. I worked as a secondary school athletic trainer for a very long time. I also work as an adjunct instructor with a local university teaching athletic training students, and I serve as a preceptor with Katie students in the high school in which I work. I've served the profession in many ways through the years. I was once president of the Athletic Trainers Society of New Jersey. I've served on the NATA Secondary School Committee and a bunch of other things through the years. I earned my master's degree in public relations, and I've used that to help promote athletic training in some of my committee roles in terms of being president of our state society and other things to educate legislators and community members about our great profession. So I put that degree to work with athletic training, and I've also earned a doctorate in athletic training from Temple University and spent some time doing some research about documentation as part of that program. Brandon, our coder, which is, he's the brains behind this whole operation. I always say I'm just the AT, he's the genius, because I just come up with things that I want our system to do, and he somehow makes it happen. So he has a business called BWC Web that he started many years ago, and he develops websites for hundreds of companies, everything from car dealerships to real estate to a variety of different things. He's also done a lot of athletic training specific work with the NATA District 2 website and the Eastern Athletic Trainers Association, which is in our neck of the woods with the Northeast. He has a bunch of certifications, and he's really the person that makes it all happen in terms of the coding. I want to announce that we recently developed ATGenius Academy, because we get a lot of questions on how to use different aspects of the system, and we're often sending off different emails about how to do this or how to do that. So we thought it would make sense just to put everything in one spot for people to learn more about our system and get resources. So we just developed this within the last couple of months, and it's up and running now. So there is a link to it from our website, and also when you log in at the bottom, there's a link to it. So there's a whole lot of videos and resources and things that you can use really to make the most of our system. When I was working on my doctorate, I did some research on the use of EMRs amongst athletic trainers and compared that to other groups such as physicians and pharmacists and nurses, and just to see what the lay of the land was in terms of EMR use among our profession compared to others. And what I found in my research is that a lot of athletic trainers who are using an EMR are also double documenting, which the research does not support double documenting. By that, I mean doing paper notes as well as EMR. The research shows that that actually leads to more errors, and having things in two different places can be a problem. And also security with the documentation is also an issue with that. I also found that unfortunately athletic trainers are a little behind in terms of EMR use compared to other professions. In this study and multiple studies, over 90% of physicians are using EMRs, and PTs and nurses, but we can't say the same for athletic trainers, but it is growing. And just by you being here today, you're helping march the profession forward and documenting using an electronic system, which we hope that regardless of what system is chosen, athletic trainers universally move to electronic documentation for the many benefits. In terms of documentation best practices, we're just going to spend a couple minutes on things that we recommend in terms of the best way to document. And I already mentioned not to double document. As I mentioned already, that leads to more errors and greater risk of patient confidentiality. So if you are double documenting, we encourage you to take a look at of why you're doing that and see if there's a better way. In my high school, for example, there are no paper records anymore. When we receive physician notes, we scan them, attach them to ATGenius, and then we shred them. We actually have some students that in the special education program that come into our facility and do various jobs. And one of them is to take our shred pile each week and take care of those documents. So we really have eliminated paper altogether in our facility at the high school. As far as patient-reported outcome measures, we have those built into ATGenius, and we're really trying to encourage our subscribers to use that, because patient-reported outcome measures really help you connect with how your patient is really doing. And a quick conversation in a busy athletic training room in the afternoon on how they're doing really doesn't cover it. But if you could give them the questionnaire and ask them, how does it feel just sitting in class, or getting up and down out of your chair, or getting out of a car, or going up and down stairs, or walking on uneven ground? It really captures a lot of things with activities of daily living, and you may uncover information about your patient's recovery that you may not otherwise have known. I one time remember an athlete that was cleared after an ankle sprain. 2 weeks later, I sent her a prom just to see how she was doing, and found out she was still dealing with ankle stiffness that I was completely unaware of, because she had been back to play. And sometimes we dismiss other back to play, they're good. But I think it's important to continue these proms even once they're cleared. And the barriers with proms are numerous in terms of, the mechanism of sending it to them. We have tried to offer a solution where you can send that to them by text message right from within ATGenius. It scores itself and appears in our system, and you can just repeat that as often as possible. And it serves two purposes. One, to really see how your patient is doing, as mentioned, but also to show your value and your treatment effectiveness of how you brought somebody from a 35% to now a 50% to 75% score, and hopefully above 90% once you clear them to play. If you need to demonstrate your treatment effectiveness to stakeholders or whomever, then this is a great way that you can do that. And the proms that are out there, the Dash and some of the Quick Fam, they're okay, but they don't always relate to the adolescent or collegiate athlete that we deal with. They're asking questions about grocery shopping or gardening or house cleaning, and trouble with those things that really don't apply to the population many of us treat. And so we developed our own proms specific to adolescents and college age athletes. And then check your practice act. I live in New Jersey, and we have one of the more stricter practice acts regarding documentation. It really outlines in New Jersey, all the things that we must do in terms of progress notes and discharge notes. So some states don't address record keeping much at all, but if you can check, make sure that you're protecting yourself legally with your record keeping process with your State Practice Act. And I just want to review the importance of documentation. Some of this I've already mentioned, and protecting yourself and improving patient outcomes, but also advocating for yourself and showing the monetary value of your services and demonstrating your patient volume to perhaps add another athletic trainer at your facility. That's what I did. I work at a very large high school and we needed a second athletic trainer full time. And so we used our documentation system to really demonstrate the volume of athletes that we see, the treatments that we're doing. And that really went a long way in showing the numbers. And we were able to hire a second full-time person at our school. The Journal of Athletic Training has produced numerous studies on documentation barriers. And I know as athletic trainers, documentation is not the most fun part of our job. And we see a lot of patients and sometimes we just don't have the time to do it right. And so we understand all of these barriers. And this is really our mission to help solve this issue for athletic trainers and helping you document quickly in the right way. So one of those things we came up with was this autofill option, and you could access this in your account under options and select autofill content. And when you have some downtime over the summer or in between seasons, I would really recommend that you create some autofills for the objective part of your SOAP note for common injuries. For example, a grade 1 lateral ankle sprain. We all see these all the time. We basically know what our clinical examination findings are going to be. It's pretty predictable. So you can create a little paragraph that will plop in right into your objective section. And we have default set in the account just to get you started, but you can edit or change any of those to the language that you use, and you can put it in your objective section. And then if you find something is a little different with that patient, you can edit that right on the fly. You're not stuck with whatever it puts in. So at my high school, we have a number of these ready to go for our most common injuries. Sometimes we get questions from subscribers and we realize that some of our users don't recognize that they need to sign and lock a record. First off, this is for legal purposes. In terms of electronic documentation, you need to actually electronically sign the document to protect yourself and make the evaluation final in some form. Granted, you can add onto it later, but you need to initially sign it. And by signing and locking it, it opens up the More tab. And we've realized sometimes that some of our subscribers didn't realize all these More tabs options are available because they're not signing and locking records. So adding a doctor's note to a SOAP note, adding it a treatment, or if you communicated with a parent about something and you want to document that, discharging an athlete. In New Jersey, for example, we not only have to indicate a discharge note, but the reason for discharge, such as past functional test or met rehabilitation goals. The patient questionnaire, otherwise known as the PROM, and then progress notes documenting physician referrals, and then creating a rehab card, which I'll talk about later. All of these are options available through the More tab that if you haven't explored these, it really adds to the dimensions of ATGenius and what the system can really do. To send the PROM, as I mentioned earlier, just go to the More tab and you can send this right to your patient's phone. When we read research about barriers in doing PROMs, our profession, we're really trying to encourage the use of PROMs, and the barriers often include time, of course, but scoring or difficulty scoring, or the bulkiness of the PROM. So we've tried to solve all this by just simply sending it to the patient's phone. They can fill it out and click save, and then it just appears right in your system for you to look at. And I teach athletic training students, as I mentioned, and I always encourage them, don't do a prom just because I'm telling you to do it or that you think you're supposed to do it. Use it to truly guide your treatment. So I always tell my athletic training students, after you do a prom, have a sit down with that patient for just a minute or two to discuss it and maybe change the treatment or adjust things or just connect with what they're saying in their prom, because doing a prom in and of itself isn't super valuable unless you actually discuss it with your patient and adjust treatment if it's indicated. And we had some requests for a mental health questionnaire. That one is in ATGenius as well. And that one forces you to do it in person. There is a code system where you have to enter a code in when you do the mental health questionnaire with a patient. The other prompts you can just send to their phone and they can do it on their own. But we felt it was important for the mental health, in case they indicated something of immediate concern, we wanted to only allow that to be done in person with the athletic trainer in case some action was needed. So we encourage you to take a look at that as well. One of the things I love about ATGenius is being able to send patient messages, and we don't need to share our own cell phone number. You can send a message to a patient. Just make sure that their cell phone is in their profile, and we make sure that we collect that when we're evaluating a new injury at the high school. We always make sure we're collecting the cell phone number of the patient, and this can be a reminder about treatment that night. Remember to ice your ankle tonight and see me tomorrow at 3 o'clock after school. Or sometimes I use it if someone hasn't returned crutches in a long time, please return your crutches, or they disappeared on us and we want them to follow up with us because we haven't seen them in a while. So this is a nice little feature that you can use to communicate with your patients. We get a lot of questions on how do I add athletes or patients into the system, and we have numerous ways to do that. One is, of course, for you to just go in and click new patient and add that patient yourself. So you're logged in as the athletic trainer, you click new patient and you add them in yourself. We have a mass import, which you can do. You need to create a CSV file and import your athletes, or you can send the CSV file to us, which many do, and we can import that for you. I will say, though, that if you plan to use some more advanced features like the rehab card and some other things, then I wouldn't recommend mass import, because that does not allow them to create their own account that the athlete can log into using their email and password. It doesn't create an email and password for the athlete to actually log in and use the system. This is just for you to put them in the system. So if you want to use more advanced features, we suggest that you have the patient add themselves in. And we have instructions on ATGenius Academy that you can basically tailor to your needs. It's pretty much all done. You just need to change a few things, the name of your school, and provide that. So we have subscribers doing this in a number of ways. Sometimes they'll email out instructions to parents before the season and instruct them to do that. We've had some groups create actually a video to walk the athletes through creating an account. We also have some that actually meet with the teams before the season. Everybody get out their phones and create an ATGenius account. So there are ways to do that. At my high school, believe it or not, I don't do really any of these per se. Well, I should say with patient ads themselves. When we have a new athlete come in that has never seen us before, we have a half sheet of paper that we hand to them that's laminated and say, here, get out your phone and create your account. I find that helps because, in a busy athletic training facility after school, that buys me 5 or 7 minutes for them to go do something while I work with someone else. So I tell them to have a seat, create your account. And then once they do that, okay, we'll get to your injury evaluation as soon as we can, but it allows them to do that while they're waiting. Here's an example of what I use at the high school. And this again is just a laminated half sheet of paper. This is available in ATG Academy, where you can just change this and hand this to your athletes to create their own account. And it's pretty simple. You can specify what you want them to fill out in the tabs. If you want their insurance info or parent guardian info, or you can tell them to skip those parts. That's totally up to you and how you use the system in your setting. I will also say that our treatment sign-in QR code, we'll get to that. The default is Bulldogs, and some people contact us how to change that. You can go and change that in your account to your mascot name, and we encourage you to do that so that treatment sign-in works, and we'll talk about that in a little bit with our slides here. We have some groups that want to use ATGenius for managing all preseason documents. So in terms of physicals or parent permission forms, or in New Jersey, every parent has to sign off that they've read a concussion information statement. So depending on your setting and your state, you can put your preseason documents up in ATGenius, and the athlete has their own account. And this is where, again, if you do mass import, we do have a workaround, but they won't necessarily have their own account to log in and do this level of things. But we can help you if you've already done a mass import to get them to this. But this is why it's best that they just create their own account. So if you want to use something like this, they already have an email and password. And we have a few options here. So say, for example, you want to upload your physical. The athlete logs in, downloads the physical, gets it filled out, and re-uploads it into ATGenius. You can also have things where if a parent needs to sign something that they've read it and acknowledged as read, we can do that, and it sends a little text message to their phone to verify their identity. So all this is set up in preseason documents, which is in what we call the athlete portal that is available to you. And it really helps if you want to keep everything all under one roof. I realize that some groups use other systems such as Family ID or other things to register athletes for sports, but ATGenius can do a similar thing with our preseason documents section. So our report section has really grown. And so we figured we needed to put some instructions, because I personally had trouble keeping track of all these reports and what they do. Initially, we just had a couple, but since we get so many requests from our subscribers, can the report do this, can it do that? We've gradually grown in our report section. So now what we've added is just a little question mark under each report that explains further what that report does. Granted that I would imagine most situations you would be using a coach's report or maybe an injury statistics report to show what you're doing, but there are other options here. And you can just, again, click on the question mark area to learn more about what it does. Okay, so on to treatment sign-in. We do get a lot of questions on this, and I find that this really can make your life easier if you have this set up. We talk to different athletic trainers who use a Google Doc for this, or they actually have a paper pen set up with a clipboard, which really isn't the best these days with FERPA and HIPAA concerns and confidentiality. And so the treatment sign-in, if you can get this set up, again, it'll make everything easier for you and the athletes. And it really works well. So if you go to account options and treatment sign-in, this is where you want to add your treatment school code. So if you are the Vikings or whatever school mascot, we recommend you use that. And that way the kids can remember when they sign in. And you can also download the QR code once you get in there. That is a modifiable PDF. So it's going to have, like I said, Bulldogs on there. That's just our default mascot name. You can change it to the Vikings or your mascot name, and then print these out and then hang them on the wall in your facility, and your athletes just scan that QR code. It'll take them right to treatment sign-in, and it makes things so much easier. In our school, we've tried different methods. We have an iPad mounted on the wall for them to sign in. We've had an iPad and an OtterBox that got passed around to sign in, but the QR code with their own phone really works the best. We also created a way where athletes can create an account on the fly. Let's say you instruct an athlete to sign in and they're not in your system yet and you don't realize that. Before, it would just deny them, sorry, no records found that matches your name. But now we've created this way for the patient not to get denied, but just prompts them right on the fly to create an account from the treatment sign-in QR code. And they just need to make sure their school code is entered in correctly, and they can do that instead of getting denied. And this was one of our suggestions from one of our subscribers, which was a really good idea. And the required fields, if they're doing this, again, this is if you scan the QR code for treatment sign-in, they're not in the system, it prompts them to create an account on the spot. These are the basics they need to put in, and then they can go right in and they'll sign in for treatment, and now they have an account. So it makes it really easy for them to do that. So in terms of adding team members, by team members, we don't mean athletic team members or someone who plays on your lacrosse team or field hockey team. We're talking about healthcare team members. So anyone who is a medical professional that will have access to enter or edit medical records. So of course, athletic trainers, or if you have some substitute athletic trainers, school nurses, or physicians. And remember, you can also add in CATIE approved athletic training students. I mentioned I serve as a preceptor, and some of you may do that as well. One of the things that makes our system unique is that CATIE approved athletic training students can have their own account. They do have some limited privileges. For example, they cannot discharge an athlete. We don't want a student to clear an athlete in our system. So we leave that to the certified athletic trainer, but they can do a lot. So it really helps teach athletic training students how to document properly. And they can do a SOAP note, they can do a concussion eval, they can do a progress note, they can do a lot of things. And instead of signing and locking, they click a button that says send the preceptor, and then you'll get an alert. When you receive it, you can edit it. You can also click on the athletic training student's name if you want to shoot an email back and say, I don't like what you put here or here, please make these changes and send it back to me. And so that is something that can make your job easier too, if some of your athletic training students are also documenting along with you. And you can also have some of your team members have read-only access. Maybe your athletic director wants access to records, but just to view, but not to make any changes or edits to anything. You can click read-only when you add that person as a team member, and they do not count in terms of pricing also with team members. Only those who are actually editing or entering records count as team members with regards to pricing. Coaches can be given access to ATGenius at no extra charge. For example, if you're in a college setting, this is where we would commonly see this, where in the athlete portal, they have uploaded all their emergency information, a copy of their insurance card, all these things in case they need to go to a hospital and the coach is there needing to access this information. This can be set up in ATGenius for any level really, but the colleges use it more to that level. And so coaches, as I mentioned, can have access to ATGenius, and they do not count for pricing or anything like that. That's just all included. It's just whether or not you want to set them up with access. They cannot access SOAP notes. So coaches can only see athlete portal information such as insurance card information, emergency contact, medical history information, but not your SOAP notes or your notes that you're making on injuries. We get a lot of questions on what if I managing multiple schools. We have a special setting called a regional manager account for this. So let's say you are an athletic trainer or a physical therapist, a manager of a clinic or a hospital, and you have 15 to 20 athletic trainers out in different high schools, you can set that all up using our regional manager account. So what does this do? This allows you as the lead point person to control which athletic trainers have access to which schools. So you can assign athletic trainers to schools. You can assign one athletic trainer to multiple schools if they're bouncing around to different schools. And the beauty of this is they have just a single login. So regardless of what school they need to access, they just log in using one email and password, and they select which school they want to have access to, and they can switch schools on the fly without logging out. You as the regional manager will have access to all schools, and again, just with one single login, and can switch schools on the fly. And we've really ramped up the reports that you can do as a regional manager for this area. So all of this is available in ATG Academy, but we do have some things on our end to set you up as a regional manager. So if you've signed up for a basic free trial account and want to do this regional manager, you just need to let us know. So we can set you up on our end. All right, on to concussions, which is probably one of the greater areas of liability for athletic trainers in terms of documenting. I once had a conversation with Kevin Guskowitz, I believe is down in North Carolina, about concussions and liability, and he often serves as an expert witness for concussion cases. And he told me that one of the biggest areas in which athletic trainers are found liable in cases is a lack of documentation. And so we've really, in ATGenius, tried to provide a way for you to do this easily. So once a concussion injury is signed and locked, you can go ahead in and click the More tab and select Add Return to Play Protocol. And you can go ahead and enter in your steps. All of your steps too are customizable. So for example, at my high school, for step 2, once they're asymptomatic 24 hours, they ride the bike for 10 to 15 minutes as their step 2. But if you're doing something different, you can customize that in your account settings, and that will be just part of your program. And so make sure that you sign and lock each individual step. This would be if you had an actual piece of paper and you were documenting all your steps. We would want you to initial each line. So this basically serves for you to sign and lock each step. And sometimes when I'm sending someone off to their non-contact practice, I will leave it unlocked and unsigned until they come back and verify that they're symptom-free, and then I'll sign and lock it. And if you're getting alerts that something is not signed and locked and all your SOAP notes are signed and locked, then I would take a look at your return to play protocol steps and make sure that each of those are signed and locked. You can also email this in the bottom right corner. Sometimes I've sent this to coaches to say, look, this is how far this athlete has gone with us. They haven't shown up since this date. That's why they're not cleared yet. We've had some requests for a return to learn. Some of our athletic trainers want to document that. So we did add that in there. And these are the basic 4 steps for a return to learn. But if you want to customize those or change those to whatever you're doing in your setting, you can do that all through your account settings. And one of the best ideas we've ever received from one of our subscribers is sending the symptom checklist to the athlete by text message. Again, we can't take credit for all these things, so we get lots of great ideas from other people. And I thought that was one of our top ideas. So the symptom checklist, whether that maybe the athlete's still at home the next day after their concussion and you just want to check in with them, it's a good way of doing that. And then their daily symptom checklist, when they come into your facility, they can just reuse the same link if it's on their phone from last time you texted them, and can update their symptom checklist, and it really makes things effortless for you. Here's the example of a return to learn symptom checklist. There are red checks if they still have the symptom, green checks if they do not, and they're scored 0 to 6. And we have a total point score, which sometimes I look at with, especially with a long-term concussion, at least to find something positive. You were a 36 last week, and now you're a 22 this week. So overall, you're going down. So that's just a nice gauge for seeing if they're actually improving. That's measurable. So again, just send it to their phone and make things easier on yourself. Some tips and tricks. So we recommend in the account settings that you add your credentials and signature. That way, if you email a coach's report or anything you send, your credentials appear at the bottom, just like mine are here. We also have a shin questionnaire. If you're evaluating shin splints or MTSS and you're trying to figure out if this person has a stress fracture or a stress reaction, we've developed a shin questionnaire. I developed it years ago and sent it to multiple schools to try out and see if we could actually predict who is at risk for stress fracture and who should be referred for their shin pain. And so what we found is that if you were in the teens with our shin questionnaire, in most cases, we don't have to quite worry about a stress fracture brewing at that point. But once you get into the 20s and especially 25 points and beyond, we're concerned with a stress fracture. So we've used this questionnaire to guide our treatment and also to justify to a parent, hey, it's time to get this shin pain evaluated. The key thing here is to make sure you repeat the questionnaire. They might have only been 16 points last week, not a concern, but now they've grown to 22 points. And now, we have to be concerned about a stress fracture brewing here. So that's something that you can send to them as you're evaluating their shin or before they evaluate their shin, before you evaluate their shin. And then this past year, we also developed Getting the Most Out of ATG document, which is in ATGenius Academy. So these are tips, tricks, and 10 things you probably didn't know that the system does. So if you're really trying to get the most out of our system, I would take a look at that document. One of the things I love about ATGenius is creating rehab cards. So if you're doing rehab in your facility, in my high school, we do a lot of rehab for our kids. So instead of the athlete tapping you on the shoulder, what should I do next every few minutes, you can create a customized rehab card in ATGenius. They would log in using their email and password, and they can follow along on their phone. They can check off what they've done. You can put in, for example, I have down at the bottom barbell back squat in the weight room, single leg press, single leg hamstring bridge, or whatever they're doing, whether it's ankle eversion, inversion with the TheraBand. You can create a list and put a weight and reps, and they would check off when it's completed, and a time and date stamps it. And you can look back on all of their history of their therapy. One time we had to use this because the MRI for an athlete's knee wouldn't get approved unless they went through some therapy first for a while. So we had actually email the list of the history of the rehab sessions to justify getting the MRI in one case. So this is really good. Sometimes, I don't really use this for an ankle sprain that's going to get better in a week to 10 days. But, some of your more moderate injuries that are going to last a little longer in terms of rehab, this is a great thing to do, and it helps them work independently. We also have a way for you to put pictures and videos. If you want somebody to do the sleeper stretch and you find a YouTube video that shows that really well, you can put that in there so the athlete can click on that in the how-to area to remind them how to do that properly. This coach's note is actually a paper coach's note I use at my high school. It's a half sheet of paper. And when an athlete comes to see us for a new injury or any change in status, we fill out the front part that's on the left, and we kind of define for the coach what limited means, what go as can means, what full go means. And we, of course, always put the time that they left our office, because we know that teenagers might say that they were with us when they weren't. They were in the hallway messing around. But we put our time on there that they left us. And on the back is where ATGenius comes in. We will check off what treatments they received that day. And they can actually scan this on the go and sign in on the go. We put the QR code there. So we have this list on the back that matches our sign in. And so you can customize this to make it whatever your treatment sign in is. And this again is in ATG Academy. So we have told our coaches never to allow an athlete back to play unless they get one of these notes back or hear from us directly through text or verbal communication. But we do use this note a lot, and it works really well for us. All right, so that's my quick in a nutshell crash course on the aspects of our system. And we do have some time if anyone, I wasn't really monitoring the chat that closely. I know Brandon was doing that. And I wanted to see if anyone has some questions that we can answer for you at this time. If you want to put it in the chat at this time, or unmute yourself and ask a question.
Okay, Case, I have one that says athletic trainer access the regional manager designation more than one school account. So an athletic trainer outside of the regional manager designation can have access only if they're within that particular region. If the athletic trainer is not assigned in that particular region, they will not be able to access in a different school. The regional manager would have to actually add that person into the school account to have access to, and we're able to do that. If you have somebody that needs multiple regions, you just need to send that request to us.
Yeah, I just was rereading that question. I just want to make sure we're understanding properly. So if you have an athletic trainer that goes to more than one school to provide services, they can access multiple schools that you control and set up. So if I hope that's answering your question. You know, if you're the regional manager and you have one athletic trainer that's bouncing around at 3 different high schools through the week, they can have access to all 3 of those schools. Yes.
Do you see the other question? Okay.
Yeah. So ATGenius Academy is basically a link from our website and from within the system. So it is separate in terms of it's basically a different website that has resources available for you. But if you're logged in, if you go to the bottom of the screen, it's kind of small print. There's ATG Academy that will take you there. And on our website, it's a little bit more prominently shown how to get there. Yeah, there was a question about, do third-party payers accept ATC rehab notes for visits? I'm sure this is by state. Yeah, I would agree with that. I know in our case, that's how we justify that they could go ahead and get that because they wanted a course of therapy first.
There were a couple other questions prior to that regarding some adding multiple coaches, automatically adding coaches and staff to the address book. We can work on that upgrade, as well as being able to select all coaches or unselect all coaches, or in the address book to send messages to. So I definitely documented that and see if we can add that to the upgrade list.
Okay. For coaches reports, you can put all of your coaches in your address book ready to go, and you can put their cell phone and their email. And when you send the coaches report, it can go to either or both. And this is one area that, you know, we're proud of, because, you know, when we have our coaches at my high school, when we first started using this system, that they were just really impressed with how the coaches report comes through and is so organized and everything. So you can send it by text or by email. You can, again, just set them up in advance in your address book.
We do look good for now. If anybody has questions or needs additional support, you can always send an email to support@atgenius.com, and we'll definitely be able to help you in any way that we can.
Okay, doesn't look like any other questions are coming through. So we were trying to keep this under an hour, which we did. So thank you so much for your kind attention, and please reach out to us if you need anything further. But thank you for attending today.